Hi, my name is Gail Bagwell, and I'm here to talk to you about a project I did on implementing an educational program to increase breastfeeding in neonates diagnosed with NAS. The objective of this talk today is to describe the method and results of the evidence-based project that I did to increase breastfeeding in the babies diagnosed with NAS. A little background information: opiate addiction and neonatal absence syndrome has become a major health problem for pregnant women and neonates in the United States. Patrick published an article in 2015 that stated that in 2012 there were approximately 21,732 babies diagnosed with NAS, which was equivalent to one baby being born every 25 minutes. From 2004 to 2013, neonatal intensive care unit admissions for NAS increased from 7 per 1,000 to 27 per 1,000 according to Tolia, which has put a large strain on our neonatal intensive care units in the United States. We also know that breastfeeding is the ideal nutrition for neonates and considered safe for women in substance abuse treatment programs. The American Academy of Pediatrics, the Academy of Breastfeeding Medicine, and the American Congress of Obstetrics and Gynecologists all recommend breastfeeding for babies diagnosed with NAS as long as the mother is in a treatment program and is HIV negative. Despite these recommendations, breastfeeding rates remain low in this population, and one of the major reasons is that as healthcare providers, we do not usually support breastfeeding for this population. My project plan was to provide educational sessions to both the pregnant women in a treatment program as well as healthcare providers in a level 3 neonatal intensive care unit. The mother's educational plans occurred over a period of 1 month and were done at the conclusion of their weekly treatment sessions done at the physician's office. The educational sessions for the healthcare providers were done electronically through the online educational system at the hospital. Both the moms and the healthcare providers had pre and post tests in order to assess their knowledge acquisition. The project implementer, myself, met with the moms after the babies were born to answer questions and assist with breastfeeding. The outcomes of this project was the moms had very little increase in knowledge. We actually used the Iowa Infant Feeding Attitude Scale to test the pre and post test knowledge. And the moms' pre-test knowledge was about 49.5 on the scale, and their post-test was 51.7, which only had an increase in knowledge by 4.5%, which is not statistically significant. But what did happen was the moms all decided that they would try breastfeeding when most of them did not think they would do it prior to the educational classes. And of the moms that did try breastfeeding, 50% of them were breastfeeding at the time of discharge from the hospital. The healthcare provider outcomes were more impressive than the mother's education. So demographically wise, we had a wide range of age, and the majority of the healthcare providers were nurses or nurse practitioners with a large range of experience. The overall acquisition of knowledge for the healthcare providers went from a pre-test knowledge of a 55.3 to 91.6% on their post-test scores. That was a 65.7% increase in knowledge, which was a statistically significant knowledge gain. You can also see from the slide that the RN as well as the NNPs, if we break them out separately, also had increased knowledge, with the RNs having about a 65% increase, while the NNPs had a 67% increase in knowledge, both statistically significant. So in conclusion, NAS is a growing problem across the country and in the state of Ohio, where I am from, and this was only a pilot project with a small sample size. This has shown that this is only one method that could help improve outcomes of babies diagnosed with NAS, because we know it does help decrease the length of stay and length of treatment for the babies, as long as the moms are in a treatment program. Initial results are promising that the intervention of providing will help decrease this length of stay, but we need to do further studies in order to determine if this is actually going to help. Thank you for listening to this presentation.